note, today 243 people have recovered from the disease. 132 from the home-based care program, and 111 have been discharged from various hospitals where they were receiving care. This brings our total recoveries now to 31,340. And I want to take this opportunity once more to thank our healthcare workers for the good work they are doing that has enabled us to achieve these results. Sadly, at the same time, we have lost another 10 patients to the disease, bringing our fatalities to 787. Once again, our sincere condolences go to the families and friends of those who have lost their loved ones. Asanteni, and I think we can now move on to the question and answer session. And I hope, as I said earlier, that most of your questions will be in the area of cancer. Thank you.
Good afternoon. Good afternoon. My name is Purity Musel from KBC. Before I get to my question on cancer, allow me to ask you a question on COVID-19.
Sure.
On the issue of reinfections, are we still relying on herd immunity? Because yesterday WHO ruled out the issue of herd immunity. So as the minister, are you following up on whether there are reinfections going on? And number two, is the country really following the advice by a scientist on what has worked for other countries in terms of the social distancing and putting on the masks? Or are we put down our guards? Maybe you can let us know about that. Then on cancer, most of the deaths that have been reported since March, the ministry had said that most of them are people with underlying conditions. I would love to know how many cancer patients have been infected with COVID-19 and the response to that, to the infection.
Thank you. Yes. Good afternoon. My name is Duncan. I'm with Reuters, the news agency. My two questions are on the COVAX initiative, which I believe the government of Kenya is a party to. Are you aware whether any adversities that might arise out of the potential vaccines that might come out of these will be shouldered by the government of Kenya, or are governments negotiating within that framework to establish some sort of liability clauses for the vaccine makers? Thank you.
Good afternoon. My name is Kagina with Switch TV. My first question, we just reopened schools. God forbid, but should the numbers spike, does the ministry or rather the government have a plan in terms of the students? Secondly, in light of COVID-19, the NCDs, non-communicable diseases, how is the state of the healthcare in Kenya in light of COVID-19?
Yes.
Sada Hassan, Standard Group. My question is on children that is resuming schools. In case a child tests positive for the virus, where exactly are they supposed to be tested from? That is now when children are reporting in case one feels maybe they're likely to be having the virus, where are they likely to get tested from? And then also the second question is on, last week you mentioned we are supposed to receive reagents into the country. Do we have the reagents right now in the country? And can you explain why we are having a sudden increase in the number of deaths over the last 2 weeks here in the country?
The last one.
I'm Haemba from Ebro TV. Waziri, maybe I would just like to know how many cancer patients have we lost for the last 7 months so far, and at the same time they were suffering from COVID-19. And then as the schools reopened yesterday, we saw some sort of funny things. I don't know whether it's sort of funny, because is fumigation of the students part of the measures against COVID-19? Kente.
Okay. Thank you. Purity, KBC. Reinfections. I think those of us who follow the literature, this is an area that not a great deal is known about. The whole subject of immunity and lasting immunity, how long this immunity lasts, when one is infected and recovers from the COVID-19 disease. I think it's a subject of intense inquiry all over the world. We're not sure whether this immunity actually lasts for long enough to be able to protect someone from a reinfection. There have also been reported cases of reinfection, by the way, and I've heard that we have also observed reinfections in our country as well. So, with respect to herd immunity, still nothing is known about that. I think as we move along and we continue to generate more information, I'm certain that we will get a good feel for the epidemiology of this disease, the immunity that it evokes, how strong that immunity is, what type of immunity it is, how long it lasts. These are questions that are still out there. And because of that, and because of the possibility of reinfection, it means we cannot, and many countries who had in the beginning felt that they could ride this pandemic wave by allowing herd immunity to develop, very soon realized that that was not working and they had to go back and institute certain measures. We as a country have instituted measures. We believe that these measures have played a big role in keeping us where we are today on our curve. And we need to continue to maintain those measures. We need to continue to maintain them even as we are relaxing some of the earlier measures that were put in place. We need to heighten adherence to those measures because that is one of the sure ways that we can prevent the transmission of the virus. Have we stuck to scientific advice? Yes, there's a lot of scientific evidence out there now that points to the fact that wearing masks plays a role in breaking the transmission of the virus, the hand washing, all the measures that we have put in place. I want to appeal to Kenyans that we should not relent on applying these measures. The simple measures which we as individuals can do and are responsible for, the hand washing, the wearing of the masks, the keeping social distance, the avoidance of public gatherings of any nature, those are within our control, and we need to be able to continue to do that to contain this virus. The number of cancer deaths that were associated with COVID, the number of deaths, COVID-19 deaths that were associated with an underlying cancer condition, I think that data we have. I don't have it on my fingertips. I don't think Dr. Kuria either has it, but we have it in our database. And we can pull that information out. I know that has been asked by two of the journalists here. We will endeavor to put that together and present it to you. But in general, what I can say is that in terms of underlying COVID conditions that are associated with COVID-19 deaths, we find that I think cardiovascular disease, diabetes and cardiovascular disease are the most common ones. There have been cases of cancer along the line and other non-communicable diseases. So clearly, if you have a non-communicable disease, you are at a higher risk of moving into the severe and critical phases of this disease with the possibility of death. Duncan from Reuters, this COVAX discussion is ongoing. As you know, COVAX is a discussion led by the Global Alliance for Vaccine Initiative, the idea being able to position countries from low and middle income countries in that queue of being able to get a vaccine if it becomes available and get it either free or at an affordable cost. Those discussions are ongoing. Whether these vaccines will have any adverse reactions once they are deployed to the market, I think that is usually taken care of by the rigors of the clinical trial procedures that it goes through, which is the reason why there has been a lot of debate about fast-tracking the process of authorizing vaccines to appear on the market. I don't think that any country wants to take those shortcuts, because that is when you will not be certain whether you have actually unearthed all the major adverse reactions that could play themselves out once you apply this vaccine to the general population. So we believe that the rigors of the clinical trial protocols will ensure that most of the adverse reactions will have been known by that time, and that only candidates that do not have these adverse reactions will be able to move through the process to be allowed market authorization and use in the public. So the negotiations are really largely at the point of what would these vaccines cost these countries? Would it be part of that Global Alliance vaccine initiative where funds are raised from some of the other donors and then they are applied toward providing vaccines towards those countries that are not in a position to afford these vaccines? So as I said, those discussions are underway. Schools. What do we do if we find that our transmission of the virus is increasing because schools have been opened? Well, we hope we don't get to that position, but it is a likelihood that it can happen. A second wave is a real likelihood for us. I think the data, as we have seen coming in, and we need to watch it very carefully over the next few days and weeks, is that we are beginning to see another steady climb following the relaxations. For instance, you can note that today our positivity rate was 12 point something. These positivity rates may fluctuate over time, but when we look at the 7-day moving average, and then we begin to see that we are moving above the 5% positivity rate, it's a danger sign that we are moving in the wrong direction. And to avoid moving in that wrong direction, we need to be able to strictly adhere to these measures, avoid public gatherings. Public gatherings are one of the biggest sources of infection of any nature, whether it is social, political, entertainment, or so on. So we will have to face it. If we find that the numbers are rising and are unmanageable, we will have to take action to restrict movements, perhaps even go back. It is a possibility that we could go back to closing schools if we see that. However, one of the things that is coming out from a lot of work that has been done outside is that especially the primary and secondary schools, the risks of children spreading, as taught earlier, is not as bad as was considered before. So we will have to closely monitor what's happening in our schools and then take the appropriate action as we deem it fit at that time. I think I answered the issue about comorbidities together with COVID-19 and the data that we shall compile and provide. If a child turns positive in a school or a child has symptoms of COVID-19, what happens? I think the protocols are very clear in terms of symptoms. If a person is symptomatic and the symptoms have been defined, the cough, the fever, the shortness of breath, and so on, then by now I think almost everybody knows those key symptoms, and there are procedures then of channeling that individual or child to a healthcare facility to be able to determine whether those symptoms are actually due to COVID-19 or something else. So a test would be done. If it's a public facility, a test would be done. Of course, we have the rapid response teams throughout the country who would be activated to come and take care of that individual. The danger lies in the asymptomatic cases where there are no symptoms at all and you will not know who is shedding viruses and spreading unless you do some level of testing. So I think going forward, some of the things that we will be discussing is to monitor how do we monitor the situation in schools where we have large numbers of students. How do we monitor? I think definitely we will require to be doing some level of testing in those populations to see whether there is transmission of asymptomatic cases. Test reagents. In one of my briefings, I think it was last week, when we were at very low numbers, I had stated that we had just received a large consignment of test kits That is why you have seen our numbers pick up in the last couple of days. So we do have sufficient reagents now that we believe will take us through the next quarter. And we also have arrangements to refill that supply line during this period. So, but I will not say that we will not experience any further breaks in the supply chain, because this is something that happens and happens everywhere because of the high demand of these commodities for testing globally. Number of cancer patients, Khaemba, your question was number of cancer patients. I think I have responded to that. And then you also raised the issue about schools now being open. I actually saw that clip on WhatsApp where children were being fumigated. That is not something the ministry recommends. Remember, when the pandemic started, there were efforts by the counties and many other institutions to put up spray booths, which were doing the same thing. We came out and we said, no, those things are not supposed to be applied on human beings. Maybe surfaces, but not on human beings. We stopped that. And I think this one too, I know that our officers have noted it and are taking action to advise schools that something like that is not acceptable, to spray children with fumigants on their bodies, on their clothes and skin. So we are aware of that and we are taking action. I think that is the end of the questions that I was asked. If you now want to ask the experts here anything on cancer, I think they are the ones who can answer you on that. Thank you. I thought the cameras came for cancer. Where are the questions for cancer? Yeah. Back to you.